What if I told you something as simple as a kiss, something as simple as a touch can actually be very detrimental to your child's health? Yes, it can cause severe problems for your child. Hello guys, welcome back to this channel. If this is the first time, you're highly welcome. So, like I said, something as simple as a kiss, something as simple as a touch can actually be very detrimental to your child's health. Now, here is why. This is because these children are born with very low immunity. Now, talking about immunity, we have two types of immunity. We have the natural immunity and then we have the acquired immunity. Natural immunity is the immunity the child is born with. So that's the one the baby comes out with. While the acquired immunity is the immunity that the child develops later on in life due to constant exposure to the environment. So now, this is what happens. This natural immunity, which is the only one the child has, yes, because the child is just coming out, just being exposed to the environment afresh, so they've not yet started producing the acquired immunity. So they are reliant solely on the natural immunity, which is made up of mostly the neutrophils and the monocytes. So now what happens is that these cells are in lesser quantity. The body is still producing these cells. They have not yet been so developed to produce enough quantity that can fight infections. So something that can be like a simple cold, something can be like just a simple cough, can actually pose severe risks to this child. Here is why. Remember I mentioned that the immunity is very low. Whenever someone is sick, there is something causing it. There is a pathogen causing it. It can either be bacterial, it can either be viral or even parasitic. Now, what happens is that when you have that cough and you touch a baby, you transfer that pathogen to the child. The child being unable to fight that pathogen, the pathogen overwhelms the body and causes severe damage or severe issues to the child. When the adult who has it, because of the adult has enough immunity, the antibodies can easily fight against the cough or fight against the sickness or fight against the disease and make the person recover fully without much complications. But here is the child now fighting for his or her life because of severe complications from this. It is still the same pathogen, but the issue is the immunity. Now, let me tell you that this is the main reason why when someone gives birth to a baby, they will tell you stay at home for 3 months for your maternity leave. It's not just for you. It's also for your child, because they want that child to develop enough immunity to fight pathogens. Within 3 months of life, that is when the baby must have gathered enough immunity to be able to sustain him or herself in the environment. So now, this thing I'm talking about, some of the complications this can cause is severe sepsis. I had a child that was brought in. This child was brought in severe respiratory distress. Like, this child could not breathe properly. While taking the history, all I could ask the mother was, okay, what happened to this child? She said, okay, nothing, no, that it's just that the aunt had cough. So she came around and, touched the baby, kissed the baby. Then since then, it started as a simple cough before it became serious. You can see it was just a simple cough, but it has caused severe problem in this child. There are viruses like respiratory syncytial virus that can cause severe respiratory issues to a child, but it's something that can easily just go away in an adult where they easily fight against it and then they are fine. Are we going to talk about the rabies streptococcus that can actually cause severe sepsis in a child, or even the simple herpes simplex virus that causes the cold sores you see on your mouth? But when it comes into a child, it overwhelms this child because the immunity is still very underdeveloped. So please, mothers, you are not wrong when you tell your visitors or when you tell your relatives to wash their hands before carrying your baby. No, you are not wrong, neither are you being overprotective. It is the normal thing to do. Number one, the first rule is that if you know this child is not your child, and then you know that you are sick, why visiting a baby, for God's sake? You can easily stay in your house, recover. When you're fully recovered, then you can come see the baby. And when you come see the baby, wash your hands. If possible, avoid touching or kissing the baby. This can help preserve the life of this child. I've had a case of a patient a baby that died. Why? Because of this same issue. The child could not fight against the infection. The child came now with severe sepsis, and at the end we lost the child. He just died from a simple touch, a simple kiss. So you're not being overprotective when you are telling people to wash their hands before carrying your baby. No. And then if you are the mother and you notice you're sick, you have cough or you have catarrh, you notice you're sick, you will not be able to stay away from your child because you're still breastfeeding the child, right? But the best thing you can do for this child is you can easily use a face mask. While you're breastfeeding your baby, you use your face mask, cover your mouth, cover your nose, breastfeed the child so that way you protect the child. Because when these children come down with these complications, the money you will spend to treat them is something else. The emotional stress it will pose on you is also another challenge. So why not, I tell my patients, prevention is better than cure. So if the best way you can prevent this is preventing people from touching and kissing your baby, then do that. At best, stay at home. At best, that's why at the end of this video, I would like you to share this video to everyone around you so that those that are coming to come and kiss will know that they should not kiss and they should not touch, while you also will know how to still protect your child against those people that have not watched this video. So I hope this video will go around so that people will know that they should stop kissing babies. They should stop touching babies. I hope you've learned something from this video. Please, like I said, share and subscribe, and we shall see you next time.